To manually obtain waveforms using the Vantage ABI, touch Menu on the main screen and then touch System Settings from the menu options. Touch the Waveforms option for automatic PVR waveform acquisition. The system default is set so the Vantage ABI can automatically obtain the ankle waveforms. Manually obtaining the systolic pressures for the arterial sites is very easy with the Vantage ABI. We will demonstrate at the right arm or brachial site. After properly wrapping the cuffs around the patient's arms and ankles, touch the arm site on the screen. A list of options will appear along the right side of the screen. Touch Pump, and Vantage ABI will inflate the right arm cuff until the blood flow is occluded. As the cuff deflates, the system will record the systolic pressure value. The pressure value will appear on the ABI main screen at the arm site. To change or re-enter a pressure value, touch the ABI site to be changed, and then touch the Enter option on the screen. Touch Clear to make a correction, Done when finished, or Cancel to exit without changes. To skip or disable a particular site, such as in the case of an amputee, touch the site to be skipped, and then touch Off. An X will appear at that site indicating it is to be skipped. To reset that site, touch Enable, and the X will disappear, so a pressure value can be obtained. If the system requires that a pressure limit be increased, an L with an up arrow will appear at the site. A pop-up warning will also appear. In this instance, touch the site on the main screen. Touch the Limit option on the screen to change the pressure limit. There are two options for increasing the pressure limit. 180 is the default, and 280 is the optional limit. Touch a selection, and then touch back to return to the previous screen. To return to the ABI main screen, touch Done. Similarly, if the pressure limit is to be decreased, an L with a down arrow will appear at the site and the pop-up warning will also appear. Touch the site on the main screen. Touch the Limit option on the screen to change the pressure limits. For decreasing, there are also two options. 60 is the default, and 35 is the optional limit. Touch a selection, and then touch back to return to the previous screen. To return to the ABI main screen, touch Done. Obtaining PVR waveforms manually using the Vantage ABI is just as easy as obtaining pressures. We will demonstrate by obtaining the right ankle waveform. Begin by touching the site on the ABI main screen, and a list of options will appear along the right side of the screen. Touch Pump, and Vantage ABI will inflate the right ankle cuff to 65 millimeters of mercury. The system will display the PVR waveform on the screen. Touch Scale to change the size of the waveform on the screen. Be sure to make the waveform as large as possible without clipping at the top. After viewing for 4 to 5 seconds, touch Save to record the PVR ankle waveform. A check mark will appear in the ABI main screen at the site to indicate that the waveform was obtained. To skip or disable an ankle waveform, touch the waveform's site to be skipped, touch Off, and then touch Done to return to the main screen. An X will appear at that site on the main screen, indicating that PVR is off. To reset that site, touch the site on the main screen, touch Enable, and then touch Done to return to the main screen. The X will disappear, so an ankle waveform can be obtained.